I decided to have the treatment because I'm a woman of a certain age, 48 to be precise. I've had 3 natural births, and I feel I'm probably at the age where I will benefit from this sort of treatment. It's just a simple machine with a simple wand which is heated to a certain temperature. It feels quite pleasant, quite warm, and the wand is used externally around my vagina and internally.
I'm talking to you today about a new treatment that we're bringing to the Skin Excellence clinics called Votiva from Invasics. This is a treatment to promote feminine well-being and vaginal, internal and external vaginal health. It's going to be a groundbreaking treatment. This is a very big area of demand, and I'm very excited to be bringing this to the clinics. Votiva is technically 2 treatments. It's Forma V, which I'm holding the probe here. This is an internal vaginal probe, and it utilizes radio frequency energy to literally heat the internal vaginal tissues as well as the external labia and external genitalia. The reason why we can use heat to get some benefits here is because radio frequency producing heat will cause a contraction of the vaginal tissues. It will cause a contraction of the skin of the external vagina. That will then promote a reaction and a rejuvenation of those tissues that will create an internal, healthier environment of the vagina. Vaginal health and how women age is quite an important issue, and often one that's not really talked about. Many women will start suffering with vaginal laxity. The muscles will become laxer internally. There'll be changes to the vaginal mucosa in that certainly around and after the menopause it may become thinner, there may be less lubrication, there may be a lot of soreness and discomfort associated with that, especially with sexual intercourse. As well as urinary symptoms become a major problem as well for a lot of women, and we know that stress incontinence, where you cough or strain and lose a little bit of urine, becomes an increasing problem in later life, especially after childbirth. Externally, the genitalia, the labia, can become atrophic, where it becomes less smaller and maybe more wrinkled, and so there is some aesthetic concerns as well from the external appearance. But it's more about improving the functional component of the vagina that we're using Forma V and Votiva for. So there are lots of benefits that can come from this treatment. We call it intimate feminine wellness, and it's a whole new speciality now that is developing in medicine, and I think a very valuable one because there's a huge unmet need out there at the present time.
Well, initially, when I arrived at the clinic, I wasn't shaved, and you do need to be shaved for the treatment. So had a quick shave. The treatment lasted about 30 minutes in total, and for me personally, there was absolutely no downtime. I walked out of the clinic, I jumped on the train, and smiled all the way home.
It uses radio frequency. This is the actual probe that goes internally inside the vagina, and we can see there are little plates here that actually emit radio frequency. Now, the effect of radio frequency is gentle thermal energy. It's a thermal warming of the tissues to allow a contraction of the tissues and then a gentle remodeling of the tissues. Now, it sounds like that could be very painful and very dangerous, but in fact it's not. The machine is very sophisticated in that the amount of energy and therefore the temperature of this probe is completely controlled. So it has those safety parameters to prevent burns or pain. And most women describe it as a very pleasurable, almost warm internal massage. There is a second element to Votiva, and that is Fractora V. Now, Fractora V is using, again, radio frequency, but with very small needles that penetrate through the skin and fire and heat a little bit more deeper to get more of a regenerative improvement. So we can use that internally and externally if there is a greater need for more contraction and more tissue remodeling. But it's a very simple, pain-free treatment, really with no downtime. I mean, most patients will immediately go back to whatever activities they were doing following a treatment. It takes half an hour or so to do a treatment. And so it's a very, very tolerable treatment with excellent outcomes. The results are, there is some initial improvement, an initial tightening, initial contraction, initial plumping of the external genitalia that is visible immediately after a treatment, and that gradually improves over time. But what we know is that it works best if people have, or ladies have, a course of treatment. So we normally advocate 2 or 3 treatments about 2 to 4 weeks apart when they first start having the treatment, and that usually gives them the full benefits that they want. And then we suggest perhaps a maintenance single treatment every perhaps 3 6 months or perhaps even yearly to maintain the benefits of their vaginal wellness. I do and have done for many years now the O shot, which is using very high concentration PRP injected into the vagina and the clitoris, and that's primarily to help sexual dysfunction, perhaps patients who have the inability to get orgasms for whatever reason, or suffer with painful sex, or any skin or vaginal skin related conditions such as lichen sclerosis, which can make sex very impossible or too painful. But Forma V also does that to a degree. So the combination of treatments means that it's going to be even more effective. And certainly I think for those patients who are suffering with some sexual dysfunction, perhaps more severe urinary incontinence issues, then I think the combination of the O shot with Forma V is an incredibly powerful tool that we have to help these women, certainly in their quest for, intimate vaginal wellness and health, and that is something that we can now achieve very simply and quite cost effectively with these new treatments.
Obviously I couldn't see what they were doing during the treatment, but I could tell from what they were saying that the doctor had noticed an immediate effect. Because your skin plumpens, it starts looking younger, I suppose. And myself, a few days later, I did a little check and had a look myself with a mirror, and I was quite pleasantly surprised at how young, plump, I suppose, and rejuvenated my vagina looked. Our vaginas are not something we generally think about. It's very much last on the list, but actually it is a pleasant, very pleasant experience. I've noticed the difference already, and so I would say yes, if you can afford it, definitely do it.